question. This is another case study. We're just looking at this one right now on the lower arch on the lower right side. And in particular, I call this one reds and oranges. And this case is one of those cases you don't want to even start, especially unless you're a very advanced person that wants to challenge the status of what a patient brings in terms of quality of bone and shape of the bone and the nerve. This might be your case. This is a two implant or two teeth here. You're looking at 29 and 30 is what you would be addressing here. And she has an upper denture. You can see the ghost of the upper denture right here in the pano view. But unfortunately, there's really not much to do here. So I basically excuse the patient that I'm not able to really achieve anything that I think would be of a high value to her. And therefore, if she wants to still find somebody, maybe an oral surgeon or somebody that would want to try to tackle this. I didn't know of any at the time of discussing with her, but unfortunately, this is a case that I basically have had excused. And let's look at 29 and 30. The next video on this case you'll see for the upper, and we'll look at the anatomy and the density of that as well. So here we go. Let's look at the treatment assessment here. The treatment assessment on bone evaluation is red on bone density, red on facial bone, red on sinus bone, red on bone characteristics, orange on bone constriction, orange on detached gingiva, orange in IA nerve position, and orange on ridge height, all in this particular area here. So let's see now on the CT, what do we actually look at here? Let's look at 29. That would be about where it needs to be. And you can see it's just now like a little knife edge. And here's a foramen here. And you've got this kind of steel woolly, very lightly steel woolly look around that bone. So the bone characteristics aren't very good here at all. And the nerve is right here. And as much as that might be going up, it's still not very wide. And here's a foramen. So that's about where we'd want it. There's really not much room to do anything. And if you could, it's basically air inside. You can see the density of the tissue here and the density in here looks very, very similar. But that is only 9 millimeters before you get to the top of the nerve. And let's say if we looked at the width here, you're only looking at 4.5 millimeters. So as much as you might want to put a 3.5 millimeter by 8 in there, I don't think it's going to do you very good. It'll be very short. Let's put one in just for 3.7 by 8.7. It's still fairly big. You could actually get something in there and you could avoid the nerve, and I guess you would have to just clip the top of that, and you can probably just hand screw it in. You probably don't even have to create an osteotomy, and you kind of can bury it in there. Whether or not it would affect the nerve, I doubt it would so much if you stayed there, but what you don't want to do is push it down and then you can't retrieve it just in case it doesn't heal, and then you have more trauma to try to get it out. So that's just kind of a mess. Wouldn't be something I would recommend doing, but that's what it is. And if we go back to the number 30 area here, let's look at that. Maybe about that part here. So you're right here. The nerve is still here. And now you still have very, very, very soft bone here. And let's see what you could do if you wanted to try something crazy. Maybe I have a 6x6. I don't have the Bicon stuff here. But a 5x7. I don't know. Let's throw that in there just to see size-wise. 5x7, yeah, you're gonna not make it, and you're right on the nerve right there. So once again, it's a kind of a hopeless scenario. People then ask about, can you grow bone up? Can you grow bone out? So if you're trying to grow bone up, what could you do here? So let me go through bone growth a little bit. in my opinion, of how this works, if the patient doesn't grow very dense bone, a remodeling of graft material or anything else, to me, doesn't tell me that she's gonna, or this patient is going to grow dense bone. If they natively don't grow dense bone, why would they grow dense bone because they have graft material? It doesn't really make sense to me. Could you grow bone up? The problem with growing bone up or out is that, how do you do that? Bone doesn't want to grow to another place for nothing. So we have titanium mesh and we have all these other things to try to help it grow in that direction, just kind of by osmosis, but it takes a very long time. It has to be stable for a very, very long time. And if the patient already doesn't have the capacity to grow bone in a native area within her bone system, I don't see how you're going to get bone to grow up or out or grow stronger bone for this patient. So you're kind of stuck. Then you can look into growth factors, synthetic growth factors, growth hormone, things like that, PRP. Some people, I think it's been shown that it doesn't help bone growth, it just helps tissue. But people still try anything. It all kind of depends on a little bit how desperate the patient is and how experimental the doctor really is, because this turns into an experimental case. There's too many reds, too many oranges going on in my treatment assessment to even start a case like this. And unfortunately, that's just the way it is. A traditional prosthetic way, maybe, to get a little more occlusion would do a system where these are splinted and you cantilever a premolar crown off the natural teeth. You know, that might be something. I don't do partial dentures, so I know other doctors do. So you probably could do a partial denture on this as well. Patient won't really want to chew on it, so I don't bother with those. Yeah, so this patient, a doctor in dental school, when I was in dental school, explained that you can't help everybody, and eventually you're going to see that some people are dental cripples. This, to me, is one of those cases in my hands, in my office. So anyway, that's an interesting little case study. Too many miracles, too many reds, too many oranges going on, and therefore it's kind of like there's too many problems, and it's better to not start a case like this, because that's going to bite you bad. So thanks for joining us on this case study. Take a look at the other case studies. Join us on live broadcasts and ask some questions if you have those. Like us on Facebook and subscribe to us on YouTube, and we'll see you later. Thanks.